For more on this, we have Dr. Nikolai Petrovsky, a public health expert and director of endocrinology at Flinders Medical Center. Welcome to the broadcast, sir. Dr. Nikolai, the trials of this new drug are showing that it led to weight loss of up to 24.2% after 48 weeks. I wanted to ask you, what are your thoughts on such a drug and how do you see this going forward?
So clearly this is exciting news. This particular drug is an extension of drugs we are already using in diabetes, which are called GLP-1 analogues. For example, we use exenatide, semaglutide. So this new drug is an extension to them. It targets the GLP-1 receptor, but also targets an additional two receptors in the body, and that may be the reason that it's giving greater weight loss. So this drug is delivering about 20% weight loss. With the earlier versions, we were looking at maybe 10 to 15% weight loss. So it does look like it may be an improvement, although it's still early stages. And we have to remember that a lot of people who are obese, who have diabetes, may need to lose, 50% or more of their body weight to get back to what we'd consider a normal, healthy body weight. So even though 20% sounds high, ideally we would like drugs that were more potent. The other thing, of course, is this is not a panacea for all obesity. These drugs only work while you take them. The minute you stop them, they stop working. Your weight will go back on. And also they do come with significant side effects like nausea and diarrhea. So as I say, they're going to be very useful, but they certainly are not going to solve the problem of obesity.
It's a very, very valid point you raised there, Dr. Nikolai, because a lot of people have issues with their weight. If everyone resorts to drugs which come with their own set of side effects, it can create further problems. There is a lot of testing which is required to go further. What I wanted to ask you was that the numbers of underage children, or I would say, youngsters who are being declared as obese, that is increasing alarmingly. What causes this kind of obesity in the youth, in youngsters, and also essentially ways that you can apply at home within your diet, simple ways that anyone can follow with which they can avoid obesity and reduce weight?
So it's a good point. I mean, in terms of childhood obesity, it's been a pandemic. When I trained 40 years ago, and at that time it was like 1 in a million children would have severe obesity. And in those days, we knew that those small number of children had genetic mutations, so it wasn't a lifestyle problem. It was that they were born with a condition that made them overeat, and that caused their obesity. Clearly, that's not true today. The children of today have the same genetics as they did 40 years ago. So now childhood obesity is 99% lifestyle. It's an avoidable problem. Obviously, part of the problem is the child, but more typically it's a problem of the environment, their parents, the fact that they're not getting enough exercise, that they're eating, as you say, too many calorie-rich foods. And so we know it's completely avoidable because we didn't have this problem 40 years ago.
Right.
So somehow we need to find what were we doing then that we're now doing in the wrong way and go back to what we were doing, as I say, in times gone past.
So put it very, very simply as you just did, just look at what your elders were doing when they were younger and you'll probably be able to live a better lifestyle. And thank you so much for joining in on the broadcast. Some very insightful inputs from you, Dr. Nikolai Petrovsky.
It's a pleasure.
Yes.